Hello all, and welcome to the first episode of my new series, The Practical Urban Prepper. For some time I've been planning to publish this series, and I've been putting together the segments by looking into subjects and materials that I feel are necessary for the urban resident. However, with the coronavirus, I wanted to launch this series a bit early to give you the information for this current crisis. This series will be focused on the practical way of preparing for those of you who reside in an urban or suburban environment. Preparing for incidents in these situations can be challenging due to many factors, such as apartment living and limited storage space. Being able to evacuate the city or the suburban area, called bugging out, with limited transportation options and potential congestion on the roadways. We're going to look at choosing the right supplies and gear that's applicable to your needs and many more issues. My intention is to show you through these videos how you can be ready and face these challenges with success. Now, searching the web, you'll find many other prepper videos, and I'm sure somewhere in the back of your mind you must be saying, hey, who's this guy to give me advice? Well, let me introduce myself. I have a degree in emergency management and planning. I have 35 years experience in each area of public safety: emergency medical services, law enforcement, firefighting, and emergency management. I've responded to and have managed many incidents and have worked with federal, state, and city agencies in the planning for disaster response, major public assemblies, and high-threat VIP movements. I must preface this video though and say that this video and the upcoming videos that you will see, that the information given to you comes with a caveat. These are my opinions that I'm expressing here, but they're based on my education, training, experiences, best practices, and lessons learned. Remember, everyone's situation is different, and so you need to apply what material fits you, your family, and your lifestyle. As I mentioned before, I was planning this series for some time and wanted to start off with a different topic. I want to introduce you to a tool that costs absolutely nothing. You can take this tool anywhere, on a plane, into a court building, goes with you everywhere you go. It can be used in every situation, and it has a deep base in emergency planning and preparing. It's called situational awareness. There are tons of definitions out there, some are very detailed, but basically situation awareness is being aware of what's around you, being aware of what's going on around you, taking this information, putting it together, and realizing how these factors are going to affect you. And then by doing so, you can make a decision based on these factors. For example, you leave your home without rain gear. As you're walking down the street in a major city, it begins to get dark, it starts to rain, the wind starts to pick up. You look up, the sky turns that deep gray, almost black. You see lightning. The wind's getting stronger and stronger. You should be thinking, well, this is a major storm coming up here. And you know what? This has the makings of possibly a tornado. Well, you've put all this together and you realize it's getting bad and you need to take shelter. Well, if you were using situational awareness as you were walking down the street, you have been aware of your surroundings and you may have already figured out a place to take shelter. Maybe in a subway station, perhaps a large store, building, office building, with a basement with minimal windows. And that's how situation helps us every day. It's a trait that if we use and apply it every day, all the time, after a while it becomes second nature and we'll always be aware of what's going on. I want to talk about situational awareness or SA in depth in another episode, but for now I want to apply it to this current health crisis we're looking at. How do we use situational awareness? Well, first thing we need to do is obtain information from valid resources, such as the Center for Disease Control and your local state and health authorities. You could also listen to trusted news services. However, I caution you, you should question what the details they're presenting to you. And be like a journalist. Go out there, fact check them from multiple sources. There are some things I've seen that the news was saying I have my doubts about. However, after collecting all the data, and one of the things you need to use too is your gut. That's always important in helping you make decisions. It's usually right, as they say. Together, it will give you a better perspective of the current crisis, and it'll make you have a plan, what you need to do to be prepared, and how to respond if the situation goes left, right, center. Bottom line is, please do not panic. I want to give you some of the numbers of the cases as I've recorded as today of March 6th. There are over 100,000 cases worldwide. The cases in China have seemed to slow down. We have over 55,000 people recovered. That's over a 50% recovery rate. That's pretty good. There are 3,400 deaths worldwide. Most of these patients had underlying medical condition such as a pre-existing immune issue, and that's probably why there was such a large cluster of deaths in that Washington State area. If you live in the New York City area, for your information, Tri-State has 25 cases. Hopefully this gives you a perspective of the infection rate and spread as it's going on right now. The following information I'm about to present has been available from the media and governmental agencies, but bears repeating. All right, we're going to talk about the issue that the coronavirus, also known as COVID-19, is a virus very similar to the flu virus, the common everyday flu virus. That means that there is no vaccine for this at the moment. It also means that there's no antibiotic that you could take that will kill it. This virus will have to run its course. If you question what are the symptoms of COVID-19, well, they're similar to the flu. You're going to have body aches, fever, cough, fatigue. The symptoms could be severe or mild. Some people don't even know they have it. However, both of these flus can result in pneumonia, which would require hospitalization. It seems now that direct contact with someone who is infected is required so that the disease can transmit to the other person through either coughing, handshake, touching face, and so forth. The incubation period can be 14 to 21 days, and that makes it difficult to predict the outbreak here in the U.S. Those infected may or may not show symptoms. If you don't show a symptom, you're what they're called asymptomatic, and that's why it's difficult. We're going to have to see what the actual infection rate in the U.S. will be, because there could be many people out there who have no symptoms who are spreading the disease. But don't fear. An interesting note, there are 11.8 million people in Wuhan, and only 68,000 cases of the disease were recorded. That's simply a 0.05% amount of the population was affected. Quite a low number. Going to talk here now about some of the common sense actions to prevent exposure. Avoid close contact with people who are sick. Stay home when you're sick. Don't go to work. Don't get on the train coughing, sneezing, and so forth, rubbing your hands on the door handles and such. Please stay home. Cover your nose and mouth with a tissue when coughing or sneezing. Throw the tissue away when you're done. Don't be like the elderly women I see all the time sticking it in their sleeves. Get rid of it, all right? If tissue isn't available and you have to cough or sneeze, do it into your elbow, not into your hands, in your jacket, and please wash. And if you do wash your hands often with soap and water for at least 20 seconds. If soap and water isn't available, use the alcohol-based hand sanitizer. The hand sanitizer should have at least a 60% alcohol solution. Avoid touching your eyes, nose, or mouth. These are ways for the virus to enter into your body. Yes, I do know I saw on TV numerous health professionals saying that and touching their face, nose, and mouth. And also practice other good health habits, Get plenty of sleep. Be physically active. Manage stress. Drink plenty of fluids and eat nutritious food. This all helps. And lastly, you can also disinfect doorknobs, switches, handles, any common areas, surfaces that people touch either in your home or in your workplace. About the use of face masks. I agree with the CDC. I don't recommend them for everyone to use. Walking around with a face mask if you're not ill does not work. So CDC does not recommend that people who are healthy wear them. Face masks should be used by people who are ill. This way it prevents the spread of the disease to others. This way, if they cough, sneeze, talk, whatever, the particulates will be stopped by the mask. The only other item I'd add here, and this is just my opinion, is that if you have an immune system that is compromised due to illness and you must go out into a public setting, maybe a doctor's visit, where someone might be sick, coughing, and such, you might want to wear a mask. There'll be a stigma to it. Everyone will look at you. But I believe it will potentially provide you some respiratory protection versus nothing at all. Once you return home, obviously dispose of the mask. You might want to wash, take a full shower, get rid of your clothing, and wash them too. Just make sure you wash thoroughly to help prevent transmission. If you decide to use a mask, use the proper mask, an N95 rating or above, as rated by the National Institute for Occupational Safety and Health. This means that this mask will filter out 95% of all particulates that are 0.03 microns and larger. Okay, it's a pretty good filtration rate. If you decide to wear it, it has to be with a tight fit. No facial hair, and I'd be violating the rules if I had to wear one, because this leads to unfiltered air entering the mask from the sides and such. So make sure you wear it properly. By the way, you should also wear a mask if you're treating someone in your household who is ill. Again, it prevents you from inhaling some of the particulates. After contact with the patient, again, wash yourself thoroughly, clean yourself up well. In a moment, I'll show you some supplies that you should have on hand and what I currently have in my kit.